Good afternoon and welcome to our Facebook Live today with Superintendent Dr. Ken Savage to answer some of your questions and concerns about COVID-19 and the procedures in our schools today. My name is Rob Spicker. I'm the Assistant Director in the Communications Department, and if you do have questions, we'd like you to go ahead and post those in the comments section there on the Facebook Live. We'll pull them from there and get to those questions in just a little bit. It's my pleasure now to introduce our Superintendent, Dr. Ken Savage, with some opening remarks. Dr. Savage?
Thank you, Rob. Good afternoon, and thanks for joining us today. I want to start by letting you know that we hear your concerns. Your phone calls, your emails, social media posts have all reached us. We understand the stress you feel about sending your children to school right now, and we know that you are frustrated sometimes with the information you receive and at times don't receive. I'm a parent of students in the district. Many of my colleagues are parents with students in this district, and we understand where you are coming from and are working tirelessly to make every day better than the one before it. To the teachers and staff watching us, I know what you are up against. Schools are getting short-staffed, the stress is nonstop, and the pressure keeps building. From all of us at the district, thank you for your commitment. We honor and appreciate the heroic work that you are doing. We thought in June that we had just finished an incredibly tough school year, and we spent all summer planning for this school year. We put in place many of the same protocols that we had last year, such as social distancing as much as possible, assigned seating with desks facing forwards, plenty of available hand sanitizer and masks, strict cleaning protocols for schools and buses, air conditioning, ventilation protocols, as well as not allowing any visitors. Everything was in place, and then the August surge hit, and it hit hard. It's important for everyone to know that as a district, we never stopped meeting, we never stopped planning, and never stopped working on ways to address student safety. We continue to have daily meetings about our COVID protocols. We are in daily contact with the Florida Department of Health and other health experts. The most important thing we do every day in our schools is to keep our students and our staff safe. To that end, we are bringing back some additional protections to our schools. Breakfast will now be served as a grab-and-go meal so that students do not congregate before class. Lunch will become grab-and-go as well, with schools opening up classrooms and other available spaces for students to eat and create more social distancing. One-way hallways and stairwells, if not already in place, as many schools already do have that in place, will be put in place. We are holding off on any large gatherings such as carnivals, festivals, and dances. Athletic teams will no longer use the locker room during halftime of their games, and we will no longer allow for volunteers on campus during school hours. We will review all these protocols at the same time we review our mask requirement with the opt-out option on or before September 10th. We hope that these increased measures will help alleviate some of your concerns. If you have questions for us today, please write them in the comments section, and we are monitoring those and will answer them shortly. One of the things we are asked about the most right now is the procedures in place when a positive case is identified. I want to turn things over to Lauren Stillwell, our Chief of Strategic Engagement, to walk you through the entire process. Lauren?
Thank you, Dr. Savage, and good afternoon, everyone. We appreciate you joining us here live or those of you who are watching later on demand. Current data from the Florida Department of Health for the week ending August 19th shows a 27.9% positivity rate in our county, and we are feeling this as a district. To put it into perspective, last year, between August and December, we had 10,000 COVID-19 reports filed with the district regarding exposures and positive cases. Between August 10th of this year and yesterday, we have had more than 6,000. In 14 days, we have received more than half of what we saw in 4 months last year. Our numbers are climbing, which begs us to repeat our primary message. If a student is sick, please keep them home and see a healthcare provider for testing and care. This is the #1 way to prevent the spread of not just COVID, but other illnesses as well. I'd like to start today with the process we use when we receive information about a positive case. Here are the steps that we take. First, the school or district COVID Command Center is notified, mainly through what we call a CIR, COVID Information Report. These reports can be filed at 3 different locations on the front page of our website, leeschools.net. These locations are shown by the arrows. Our health and safety protocols are also there as well for future reference. Once we have that report, schools will pull the seating charts and identify close contacts, sending the information to the district's COVID command center. Nurses there will check the information and send it to the Florida Department of Health in Lee County. We are incredibly lucky to have a collaborative relationship with our partners at the DOH. Within the week, we should have the technology in place to embed their staff into our COVID command center in order to help streamline communication and provide faster response. Once the DOH has the positive case information and close contact list, they investigate and send quarantine and isolation information to us. We send that information to the schools, and the schools in turn notify families with return dates. On the surface, this is a very easy process. However, with the volume of cases and exposures we are receiving, we are behind in processing these reports. We are hiring more people to help, and just this week trained 13 additional staff members who will be coming in after hours to assist. Under the emergency rule released by the State Surgeon General on August 6th and updated last week, these are the requirements that we follow for exposures, positive cases, and symptomatic students. We'll start with number one, which is an exposure. An exposure means that someone is within 6 feet of a positive case for 15 minutes or more in a 24-hour period. The time frame is not all at once, it is cumulative, so it could mean that it's 5 minutes here, 10 minutes there, etc. Moving to the right on number one, if a student is non-vaccinated, exposed, and asymptomatic, that student may return to school with a negative diagnostic test that is taken 5 days or later from the day they are exposed. That's important because we're seeing many COVID information reports where a student is tested on the same day or the day after they are exposed. The test must be taken 5 days or more after the exposure. Another way a non-vaccinated asymptomatic student can return is after 7 calendar days have passed since the exposure, and that means they can return on day 8. If a non-vaccinated student is symptomatic, then they must follow the protocols in Section 2 on this flowchart because they are considered presumptive cases. So with that said, let's move on to Category 2, symptomatic or COVID-positive students. Under the emergency rules, symptomatic and COVID-positive students are treated exactly the same. They may return after one of 3 things happens. The student receives a negative diagnostic test and is asymptomatic. 10 calendar days have passed since the onset of symptoms. The student has had no fever for 24 hours, and the student's other symptoms are improving, all without medication. Or the student receives a note from an MD, DO, or ARNP to return, and the student's symptoms are improving without medication. The type of medical professional who writes the note is dictated in the State Surgeon General's rule. Now we move to Category 3, and that is if a student has had a prior COVID-19 infection within the previous 90 days and is asymptomatic, no action is required and that student may remain in school. However, if the student is symptomatic, then they must follow the steps in Section 2. Finally, in the green box down at the bottom of the screen, if a student is asymptomatic and fully vaccinated, which means it's been 2 weeks since their final dose of the vaccine, they do not need to quarantine if they are exposed to a positive case. If they are symptomatic, however, then they must follow the guidance in Section 2. This is a lot of information, and we understand that. Later this afternoon, this flow chart will be sent to all families through School Messenger and is also posted on our district website for further review. I do want to bring to your attention the section with the orange arrow at the bottom for a minute, which talks about using diagnostic tests to return to school. Under the State Surgeon General's emergency order, home tests are allowed. However, that home test must have emergency use authorization from or full approval by the Food and Drug Administration. The test must be used correctly as defined by the FDA, which means if someone is symptomatic, they can only use a test that's designated for symptomatic students. Finally, the results of a home test must be sent to a laboratory done through a mobile application or monitored by a medical provider. If a student has a test result that shows their name and a negative status, they may send that documentation to school in order to return. When we have a positive case in a school, we will report those on our website. This is a mock-up of what that reporting tool will look like. The table will show confirmed positive COVID-19 cases associated with our school campuses. The first section is the daily number of cases broken down by students and employees. The second is cumulative information from the first day of school. This information does not mean that the student or employee contracted COVID-19 at the school. The page will be updated daily based on confirmation of a positive case by the Florida Department of Health, Lee County. If there is a 0, there were no positive cases reported for the school on that day. We are currently authenticating the data and making some adjustments and hope to have this launched on our website by the end of the week. We do continue to send letters to all families at a school when a positive case is reported. That may go away once this tool is launched, but we will let you know if that happens. If a student is isolated or quarantined due to COVID-19, they should access their lessons using the Google Classroom. They can also email their teachers for assignments and assistance. In addition, we are offering a K-12 tutoring program called Connect with Lee. We launched this last year and it was extremely successful. Connect with Lee is staffed by teachers who offer live help and support for classroom assignments. The program is available now on school days Monday through Thursday from 3:30 p.m. to 7:30 p.m. Students can access this program using the Launchpad on their Chromebooks. We are looking to expand Connect with Lee during the daytime hours and will launch that on September 7th. Turning now to our health and safety protocols. As Dr. Savage mentioned, over the summer and through the first weeks of the year, the School District of Lee County has been working internally and with our healthcare partners to research, plan, and implement health and safety measures for our students and employees. At the beginning of the year, we put the following protocols in place on our school campuses: social distancing to the greatest extent possible, a mask requirement with an opt-out, desks facing forward with flexibility for small grouping of students for learning, assigned seating and seating charts in order to be able to contact trace, the availability of hand sanitizer in key places in the school, and students are also encouraged to bring their own. We teach and reinforce hand washing and respiratory etiquette. We have limited water fountain use and instead are using bottle filling stations, and students are encouraged to bring their own water bottle. We have not allowed visitors on campus during school hours, and we do have isolation rooms at every school with students with COVID-like symptoms. In addition, our cleaning measures and indoor air quality protocols include high-frequency cleaning of common surfaces, positive case-triggered cleaning protocols, which are followed when an individual has been diagnosed positive and has been in our vehicles or on our campuses within 24 hours, regular cleaning of areas where food is prepared, stored, and served, quarterly air filtration replacement, disinfection of playgrounds at the end of each day and having students wash hands or use hand sanitizer before and after play, and cleaning and disinfection of school buses after each run, both in the morning and in the afternoon. As we continue to see the COVID-19 positivity rate climb in our county, we have also decided to reinstate additional health and safety protocols that were in place during the 2020-21 school year. Dr. Savage mentioned some of these in his opening remarks, and they include grab-and-go breakfast and lunch, meals eaten in classrooms and staggered seating in cafeterias to avoid students sitting face-to-face, secondary classroom desks being wiped down after each class change. We are currently holding on large gatherings like carnivals, festivals, and dances. There will be no locker room use during the halftime of games. We will reinstitute one-way hallways and stairwells for those schools who are not currently using their buildings that way. Field trip and athletic travel will use an increased number of buses to maximize spacing. Field trips will be district-sponsored only with school staff chaperoning, and for the time being, volunteers will not be allowed on campuses during school hours. All of these protocols will be reviewed at the same time we review our mask requirement with opt-out, which is on or near September 10th. It is our hope that the positivity rate will be on the downturn so that we may relax some of these protocols, but if not, they will remain in place. We continue to work with our partners at Lee Health, Golisano Children's Hospital, and the Florida Department of Health to provide COVID-19 testing and vaccines to students and employees. We are hosting the mobile vaccine clinic at our schools, and in fact, we have 4 upcoming opportunities. And we will start COVID-19 testing in the schools for students and employees either later this week or at the beginning of next week. These are completely optional, and in every case, a parent or guardian must be present for a student to receive a test and/or the vaccine. As mentioned before, we are operating a district COVID-19 command center. This is for parents and employees who have questions about our protocols and processes. The center is open on school days Monday through Friday from 8 a.m. until 4:30 p.m., and the phone number is on your screen, 239-356-2800. We are hiring additional staff to work in this command center to provide a more timely response to calls and COVID-19 reports that are filed. Please know that we care deeply for your students and our employees. We understand that many of our families are increasingly scared for their children in the midst of this tumultuous time. We hope that this information and these additional measures ease some of those concerns. We will not stop looking for ways to better protect our students and employees, as well as ways to deliver the best educational experience for all of our students during this difficult time. And with that, I will turn it back over to Rob Spicker, who will field questions.
Thank you, Lauren. And we have been watching the questions come in, and they've been in a group of a lot of questions asking the same thing in different ways. So we're going to go through some of those top ones now. So Dr. Savage, the largest question really in many ways has to do with masks, questioning what is the district's current position on bringing back a mask mandate without the opt-out option. So where are we?
Thank you, Rob. And this is definitely a question we received quite a bit on this piece. Just want to first kind of reiterate that essentially our district position currently has just been to abide by the law as stated by the governor in an executive order that clearly delineated that masks, while they understood there were desires to have masks in our schools, that they wanted to validate parent choice over that piece. Of course, it's very controversial because just having folks be able to opt out of that then makes a universal mask recommendation less effective. And so we have, I believe, over 14,000 parents that have taken advantage of that particular opt-out through our formal mechanism. There are maybe others that have used a different method, but those are so far that piece. This is really something that our board takes very seriously. They have received just tremendous amounts of communication, my office as well, about families on both sides of this issue and staff on both sides of this issue. So we certainly recognize that. The governor, when he issued his executive order, he also did so citing the Department of Health as well as the state Surgeon General. So that is something that right now is our best interpretation, that is the law. However, there are many districts in Florida that are essentially challenging that. There's even some lawsuits currently out there that are essentially asserting that the governor may have exceeded the constitutional authority in that executive order. So those are things that are currently being evaluated, and we continue to monitor exactly all these district stances as well as the legal arguments they have to defend that piece. So from my perspective, I have personal beliefs. I have personal thoughts. I try my very best not to allow those to infiltrate the decision-making process. I really serve as an executive. My job is to enforce the law and enforce the board's policy. That really is my role in this district. So I really do enforce the policies that are there, and I am bound to enforce the law as well. However, when there is a law in question, that is how we trust that judicial process, as well as rely upon the arguments, the legal arguments that other districts are making to attempt to validate their perspective as well. It continues to be an evolving story every single day. So as I've said many times, we don't take any option off the table, but our current best understanding of the legal constraints is that we are observing the governor's order while still allowing parents to make that choice. And of course, parents who feel uncomfortable with that, there are additional options on both sides to avail themselves of educationally.
And that leads us to the main theory of question number 2. Lee Home Connect was a popular learning model last year. It is not available this year. How come? Can it come back? What kind of virtual learning options are available?
Yes, this was one of the most troubling aspects of this year compared to last year. Last year, we really had an opportunity with our Lee Home Connect. While it may not have been perfect, it did allow for us to have a live version of instruction happening daily for our students. And we know that we love having our students interact with our teachers every day. That is so powerful, and we just know so many students benefit from that. However, nowhere in the state were they permitted to continue to engage with the innovative learning models that were permissible last year. We continue to try to evaluate mechanisms to get around that particular piece, because we understand that legally we have certain obligations, but we also want to make sure that we're coming up with supplemental measures to assist and help in what is a very real concern right now for families who are at home. They don't feel like they can teach their kids the way they want. They want some additional resource beyond what they can get in the virtual platform, and we continue to work on supplemental measures that we'd like to do. An example of a supplemental measure that we already have in place is our Connect with Lee, and that is basically an after-school tutoring option that we have live people able to assist some of those students who may be virtual students or working at home to continue to get questions answered by our educators after hours to do that. In fact, that is something we're expanding, so September 7th we'll actually have that same supplemental service offered during the day so that families and students can get that additional assistance during the school day, which is not, again, the same as what we had with Lee Home Connect, but it continues to be another option to try to enhance the amount of support that our families are getting, because we recognize that many parents do not feel confident to try to do that home learning, and we recognize that safety is such a concern right now.
There's a real thirst for knowledge and information, so a theme of the questions is, what is the status of our local COVID dashboard reporting system that we're working on?
Well, that status, that dashboard continues to be developed. We believe that we can have this up and running by the end of the week. We're trying to have a pretty robust dashboard that tells us by school. So we have the staff that are down, we have the students that are down, so that families can have the best possible information they can about all of our schools. It just is the massive scale of what we're doing is very difficult. And so we're working to get that done as quickly as possible, and we do anticipate that it should be up and running by the end of the week.
Another common question was about the protocols that we've just run through, and how are they being communicated to school administrators and teachers. Based on the questions, there sometimes seems to be confusion about the messages being delivered to families.
Yeah, one of the biggest challenges right now has been communication, just in general, because it's such a dynamic picture. We are constantly having to adapt, both based on guidance from the Department of Health, based on trying to keep pace with all the different pieces that are coming at us. So just communicating with all those changes is a challenge. So one of the things we've done is continue to meet with principals on an ongoing basis to hold Zoom meetings. For example, the most recent Zoom meeting we had, we scheduled an hour, but we ended up staying on for an hour and 45 minutes, just so that every question could be answered that principals had in terms of implementing in their buildings. Additionally, our pandemic team, which meets at least 3 times a week, if not more frequently, they are always taking time to take basically questions that principals have identified, implementation challenges at their site, and answer those on a case-by-case basis. That's done via Google Forms, so that we have the chance to be able to see that real-time answer and just the questions that they're facing every day. We have that ability to answer. I will say this, no two schools are exactly the same in terms of their physical layout. And so there are challenges sometimes with some of the older school campuses and how to maximize the space. And then, of course, enrollments are different. So there's just a lot of challenges on a case-by-case basis. Fortunately, we have a great school-based support team here. We have a lot of our staff here at the district office that have been pushed into schools to try to supplement some of our staffing shortages. So we've been hearing about a lot of these challenges since we've opened school, as well as the admin teams. Really, we work very closely with our school executive development team, so they really help to address individual challenges where, worsening cases where multiple staff are out at an individual school. That district support is there to help them with that implementation as well.
And another question was, can the district send out all the COVID health and safety protocols to parents to make sure that they have this information as well?
Yes, some of these most recent changes, they're coming out today, just some of the ones we've gone over today. And this kind of gives you a sense of what it's been like for us through the entire summer and then through the beginning of school. We continue to add protocols. We continue to kind of modify the situation. We continue to engage with all of our health partners and try to get the best guidance that we can. We constantly compare notes with what other districts are doing as well, looking at their provisions, just to ensure that everyone is kind of benefiting from the shared wisdom of all of us going through such a difficult time together. And so that is something that we are sending out. It's also available to our families 24/7 on our website. And so we're continuing to try to make that as accessible as possible through our website. We encourage people to click on that website. If they have any questions, we also have a COVID hotline. And so we encourage people to be able to call and report those cases through that COVID hotline. We continue to increase our staffing for that COVID hotline so that we have more people available. That's just been a real challenge, I can say, is just like our whole community has been hit by staffing challenges. So have we in the school district, in every aspect of our organization. And so it's impacted us in our ability to track and respond to cases. For example, in the first couple weeks of school, we had over 6,000 reports that we had to do, which we call our CIR, which are these reports essentially to track positives and things along those lines. For the first 4 months of school last year, we only had 10,000. So just to kind of do a contrast there, 2 weeks, 6,000, over 4 months of time, over 10,000. So that kind of tells you just what kind of surge we're in the midst of. And that's really where we are right now. We are in the midst of a surge. And so it has just completely overwhelmed not just our system, but systems all across the state. And really, Florida has some of the most infection happening in the entire world. So we are really doing the very best we can. I can assure all those families at home, everyone is working so hard to try to tackle this challenge, and it is requiring tremendous flexibility for all of us to do that.
Those were the main focus of a lot of the questions. Do submit questions. We will be going through them on Facebook and posting answers to the most frequently asked questions for you there as well. We thank you for watching and posting those questions. Dr. Savage, any last words?
Well, I think I can just appeal to folks that, I'm a parent. My kids are in our schools. It's a terrifying time in our community. The Delta variant has brought a whole new level of concern for all of us. We continue to engage with our medical professionals every day. It's necessary. We talk to them daily because we want to know what's happening in our system, our local providers. How is it impacting their system? This is an all-hands-on-deck moment for our entire community. We understand that for some reason, the politics have entered this fray, but for us, this is not a political issue at all. This is all about trying to keep our kids safe every day and still allow learning to take place in our community. I just pray every day that this surge will end and that this terrible time that we are experiencing will end as quickly as it possibly can. At the same time, it's just a time period that's a dynamic challenge, and so we continue to look at everything that's happening across our entire state. We are monitoring all these other districts. We are monitoring the legal issues that are there, all of the flexibility that we are afforded to follow the law, but to really constantly find a way to just keep our kids as safe as possible, but also allow learning to take place to the best that it possibly can. We are just trying everything within our power and ability to tackle this issue, and just know that there isn't a single day, a single night that goes by that our entire system isn't totally dedicated to trying to keep our kids safe, but also to help them learn and to protect our people at the same time, all of our workers. So we just really appreciate any of the faith that these families have shown us. Know that we are really we're here for you. We're here for this community. We know that when kids are in school, the community can work and people can go about their daily lives. We recognize we are the state of normalcy for our district, for our whole Lee County, and we take that very seriously. At the same time, we are all in the midst of really an unprecedented moment for us. And so just please, whatever grace and compassion you can show for us as well as we go through this, we are doing everything we can to try to serve this community.
Trying times for all. Thank you, Dr. Savage. Thank you, Lauren, for your presentation. Thank you, everybody, for joining us. Again, we'll continue to post those questions. We will be putting up answers to as many of them as we possibly can. Thank you for joining us.